wanted to talk to you a little bit about the difference between seeing a GP and seeing a physio for a musculoskeletal problem. So a lot of people will go in the first instance see their GP because they want to make sure that there's nothing serious going on, anything that's sinister in pathology. So people have often got past experience of loved ones who had headaches or sort of pains that may have been linked to heart. So for example, pain in the left arm can sometimes be linked to heart problems. They may have seen people who have had very minimal musculoskeletal injuries that have resulted in being something a bit more sinister in pathology. So quite rightly, they want to see a doctor. Now, it's important to remember that musculoskeletal problems, so those are things like knee pain, back pain, shoulder pain, that are related to things like the tendons or the joint or the soft tissue structures around them. Those are the sort of things that physios are expert in. Now, GPs do a fantastic job, and I would not want their job. I mean, I considered being a doctor, but I thought, oh gosh, 10 minutes with my patients, I can't do that. I talk too much, I want to ask too many questions. So what I want to do today is tell you a little bit about what we do in a physio assessment, which is slightly different. So whereas a GP is trying to work out more like a gateway service, they're trying to work out whether there's any first line of defense, such as medication or treatment that you can have on a low-grade level, and then if you have got something a little bit more complex, then their job is to signpost you to the correct place. And as a physio, having been a physio for 9.5 years now, you get used to looking at these pathways and understanding these pathways, and I wanted to explain that a bit to you now. So generally, when someone comes in with a musculoskeletal problem, what we're going to do, we're going to ask a series of questions to make sure that there's nothing that we might be missing. So physios are autonomous practitioners, so that means we can see you without you seeing a GP first, and we're going to be asking questions that may mean that your symptoms are linked to something that is not musculoskeletal in nature. So for example, sometimes your kidneys can refer pain, sometimes abdominal contents can refer pain, and there's certain patterns that we're looking for that. The classic one which people are often worried about is things like heart and then that going down the left arm. You can sometimes get tingling as well, but there's lots of things that cause tingling that are not linked to the heart, and that's where physio comes into play. So what we do is we investigate. So if you imagine Sherlock Holmes, when he's investigating, what he's doing is he's asking a series of questions to get to the evidence of what is apparent and what isn't. So the best way to do that is actually to rule out everything that it isn't, and then it gives you the most likely possibility of what it is. Now, we have to be very careful with not saying it's absolutely definitely this. Now, although patients like a lot of certainty, actually what we know is that lots of the time when you look at experts and you ask them to diagnose things, they'll have slightly different ideas of what exactly is going on, but when they look at the research and follow those practitioners treating them, they will get those patients better, even though they use a slightly different approach. Now, I want to share with you an example. A few years ago, I went to the shoulder symposium with a very leading shoulder specialist called, you've got Mr. Levy, who works with him, and then I can't remember the main guy's name. There's loads and loads of research. I'll put a link, actually, that's probably the easiest thing to do. He unfortunately died a couple of years ago now, but he was the pilot of the shoulder replacement surgery. So he got all of these consultants from all over the world, and there was some incredibly well-known people there. There was an absolutely amazing shoulder bone expert who I got to have a talk with. It wasn't really for physios, but physios were allowed to come along as well, but it was mostly for consultants. And what really struck me about that experience is you had the top experts in the whole world all in one room, all discussing cases, and they all were arguing. They all were suggesting different things. So what they did is they had patients that would come up onto the stage, whichever the consultant that was presenting the case would explain exactly the patient's symptoms, how they'd seen them in clinic, the management they'd done already. And then it was the group's job to discuss and see if there's something else, just a clinical discussion to see if there's a better way or perhaps a different way that we would consider doing it to help us to all grow and develop. Now, the one thing that I really noticed is this poor guy, this one particular guy, I remember him really well. He was sat on the stage and obviously feeling a little bit overwhelmed. He had had nasty shoulder pain for about a year. He'd had something called a frozen shoulder, and there's lots of different there's lots of different ideas of what we should do with a frozen shoulder depending on which research group the people had come from, because a lot of these consultants were actually participating in research studies themselves, and that's why it was helpful to bring all the evidence, because they all had a different level of knowledge and they all had different experiences with patients as well. And this poor guy was sat there looking completely overwhelmed with his pain, and I really just wanted to go and give him a hug. I thought, no one is considering the patient, no one is putting the patient in the center of all of this, and that was so worrying. But unfortunately that is very common, because when you get to the stage that you're a consultant, you don't have much time, and they are fantastic. They're having to do very tricky surgeries, and I'm very grateful for everything that they do. But it's very important that the patient understands, and that's where physios are that little link. I think we're slightly better at that. Our communication skills sometimes are a little bit more helpful in explaining exactly what's going on, understanding the false beliefs that a client might have. For example, that they're going to tear or damage the injury, or that they shouldn't move. We kind of help break those sort of psychological barriers down to help you be able to move. So what was fascinating about this particular guy who had his, he was looking at having a manipulation under anaesthetic, and then they were looking at, well, what was the provision after? Because we know with a manipulation under anaesthetic for something like a frozen shoulder, we know that you need lots and lots of physio after it. And it was interesting because even though you had all these people in the room who were supposed to be the best in the world, all of them had different ideas of management, whether they should have physio, whether they shouldn't have physio, whether you should do a arthroscopic incision or whether you should do an open incision, whether you should be using this particular type of suture or whether you should be using this particular type of suture, whether you should be putting local in with it, or and the quantities of local. So it was really interesting to see that even experts, supposed experts, I mean they were experts, particularly the guy I spoke to on bone. I mean he was, I can't even remember, I'm terrible with names, but he was a top guy in bones. And I actually had a discussion with him because when I did my ISIS training, which is, now ISIS is not a very good term, but back then when I did my training, it was the intermediate care trauma in sport or something, which I was doing when I was doing my premiership rugby. And they were saying, they were teaching us techniques to help to reduce if you were to dislocate your shoulder, to help relocate it. And I said to the chap, I said, look, what I don't understand is we have been advised that if we can put it back pitch side, that this is better. And I said, what is your opinion on that? Because I've just watched you do your speech all about bones, and you've just told us that actually if you have a complex greater trochanter fracture, that actually if we reduce it pitch side, we can damage it. He was saying actually that can be a life-changing injury for that particular, because of the blood supplied with that particular type of fracture. It would mean that it could be a career-ending surgery for that person if there was a fracture. And he said, well, what do you think? He did a very clever coaching technique, and he said, well, what's your opinion on it? What do you think about it? What do you think from what I've said? And I said, well, you suggested that actually without x-raying it first, we don't know whether there's a fracture, we don't know whether we're making the fracture worse by relocating it. And he would say, I would agree with that. He said if there was no circulation deficit, if you check the pulses and the circulation was normal, he said I wouldn't relocate it because you could cause more damage. And I said, well, the argument that other physios have said is that actually by leaving it out, it's very painful for the patient, so the patient will be happier normally if you relocate it, but they said also you're causing damage to the nerve and the stretch. And he said to me, well, interestingly, you're much more likely to cause the damage to the nerve as it's being dislocated. So it's always interesting to get in with experts because they disagree. So be careful that you don't get set on this is the right, this is the wrong. What we need to do is we need to work out what works for you. The rehabilitation that we're going to do for a 60-year-old elderly person, well, 60 isn't elderly, 80-year-old elderly person, is going to be very, very different than what we do for a 15-year-old athlete. So you need to find people who understand you. So that's why sports physio is sometimes quite good. That's why I often say to people, if you play sports booking with Abby, who's a sports therapist, because she has played at Premiership Rugby and she knows what it's like to be injured. She knows the psychological impact. She knows how to help you overcome those hurdles. And that's why for people who may have neurological deficits, that we say to go to Meg, because she has a very gentle approach. So for people who are a little bit more anxious, she really helps to make them feel very secure. So with people who are coming in who are very worried that physio is going to be painful, a lot of people, the barrier for physio is that they're not quite sure, A, whether it's the right thing for them, or B, whether it's going to be painful. But what they don't look at is the fact that they've been in pain for 3 or 4 months dealing with it, and sometimes the things that we do in physio can be a little bit uncomfortable, but you're never in a situation where you aren't in control. We give you a really long 45 minutes, which includes treatment for your initial assessment, and what we do is it's very thorough. We go through the questioning, we make sure that you can cope with everything, we help to educate you so you actually understand what's going on inside, which is so important, and for your recovery, and also to make sure that these symptoms don't come back, and to help to train you about compliance. The thing with when people are going in for the GP, often I hear people say is, well, I don't really feel like they had a chance to listen to me, and it's not the GP's fault. They've got 10 minutes, like it's not long enough. Whereas when you're coming in to see a physio, you've got that bit of extra time to ask all the questions, to speak to someone who is approachable, and if you're not ready to come into physio, just put an Ask Nicole tag and send me a message. I'm quite happy to answer any questions. Of course, it's difficult for me with specifics if I haven't got the whole picture, but I can answer basic questions. Anyway, I hope that's been helpful, so you know the difference between a GP and a physio. GPs are very much signposts. Physios are specialists in the musculoskeletal system, so we spend all our time learning about nerves, muscles, joints, the soft tissue that surrounds, and we're really looking at trying to, and other times people are saying, well, I don't know if it's a chiropractor for a back. Physios do, I mean, I can't tell you what a chiropractor does. I've not trained as a chiropractor, but physios, we do necks, we do headaches, we do shoulders, we do elbow pain, we do sports injuries, we do urinary incontinence. And so many people always say to me, oh, I didn't realize you do that. But follow Instagram, follow Facebook, start educating yourself and see whether we can help you or a loved one. Even things like mobility, we can help people reduce their risk of falls. You know, if someone has a fall and fractures their hip, that's a 30% chance of mortality within a year. Like, that is a scary statistic. And it might only cost, you know, £100, £200, maybe even just £40 if you're in an early stage, to educate your loved one, your parents, about this balance and getting strong and investing. I mean, that's a much better present at Christmas than getting them some chocolates. Get them a physio assessment, get them you know, educated on their bodies, because sometimes people don't realise their balance is bad. I'm treating a chap at the moment who I actually met through his wife, and because I was so worried when I was walking out to the car, I said, gosh, you know, actually I probably need to see you more than your other half. And he now is back walking without sticks. He's just doing amazingly, but for him, he hadn't quite realised how bad his balance had got and how at risk he came in the other day, and he said to me, do you know, I haven't felt like I was going to fall all this week. I haven't felt like I was going to fall. Can you imagine living your life thinking every second of every day that you're going to fall? So yeah, anyway, I'll see you later, guys. Bye.